Go live button, and we're ready to go.
Half a day and good afternoon, everyone. Thank you for joining the Healthcare Authority's Facebook Live event in an overview of the COFA and Medicaid transition. This conversation is a continuation of our April 13 Facebook Live event when we discussed the Medicaid transition and what is to come. Here we are. This is something our COFA communities have hoped and advocated for. My name is Roz Leon Guerrero, and I am the COFA Islander Programs Manager with the Healthcare Authority. Joining me facilitate this event is Ariel Pirtek.
Thanks, Roz. I also work at the Healthcare Authority in Medicaid eligibility policy and COFA Islander Programs Manager as well.
Thanks, Ari. Also joining us is Diane Baum. Diane, could you please share a little about yourself?
Hi, everyone. I'm Diane Baum. I'm a management analyst with the Healthcare Authority, and I assist with ProviderOne enrollment and transition.
Thank you, Diane. We are very excited to have community members join us. These community members are part of the COFA Advisory Committee. This partnership has really helped in the anticipated smooth transition to Medicaid for our COFA communities. Could I ask Doris T to please introduce yourself and the work you do in the community?
Thank you, Roz. My name is Dorothy. I'm from the Marshall Islands, and I've been a member for the COFA Advisory Board ever, from the beginning of the program. And I live here in Spokane.
Thank you, Doris T. This would not have been successful, and your advocacy and dedication to our COFA communities is very admirable. Thank you so much. This afternoon, we will cover Washington Apple Health Restoration, Apple Health and Managed Care Plans Overview, and walk through some scenarios you might relate to, ways to stay connected, additional resources, and open for questions and answers. I'm going to share my screen on a short presentation that we have prepared for you. Can you all see my screen? Perfect. So today we're going to cover, again, Washington Apple Health Restoration, Apple Health and Managed Care Plans Overview. We'll walk through some scenarios and apply what we've learned through the presentation. And we created these scenarios as, these could, our COFA communities could relate to some of the scenarios, ways to stay connected. And we have resources for our COFA communities, and then we'll open up for questions and answers. Please send us your questions throughout the Facebook Live event, and we will respond to them at the end of the presentation. The Medicaid restoration. The Consolidated Appropriations Act 2021 restored Medicaid benefits for individuals from the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands. COFA Islanders were limited in their ability to receive Apple Health prior to Medicaid restoration, although children and pregnant individuals were and continue to be eligible for Apple Health. We are updating our eligibility system to allow COFA Islanders to receive Medicaid as qualified non-US citizens exempt from the 5-year bar. The COFA Islander programs transition. COFA Islander healthcare enrollees under age 65 without Medicare will transition to Apple Health for adults on July 1st. Their COFA Islander programs and qualified health plan will end June 30. Individuals in the COFA Islander healthcare who are age 65 and older, or those with Medicare, must apply for Apple Health through Washington Connection with the Department of Social and Health Services. They will remain on COFA Islander programs until the eligibility determination is complete. When COFA Islander healthcare ends, the COFA card, also known as the Navia card or cost sharing card, remains active for 3 months. The COFA card may be used to pay bills for services received when an individual had COFA Islander healthcare. They may not be used for bills related to services received while on Apple Health. If an individual in the COFA Islander healthcare is in need of additional funds or receives a bill after 3 months, they may contact the healthcare authority for assistance. An application is required to determine if an individual is eligible for Apple Health. COFA Islanders must meet all eligibility requirements to qualify for Apple Health programs. COFA Islanders are encouraged to update their Washington Health Plan Finder applications if they were previously denied or terminated. As we prepare for the transition, before the system implementation, there are a few things COFA Islanders can do to prepare. They can ensure their Washington Health Plan Finder application is up to date. This includes their addresses, household members, and income. They can submit a new application in Washington Health Plan Finder or Washington Connection. They can also designate an authorized representative, and they can check with their providers to see which managed care plans they accept. And I would turn it over to Ariel.
Thanks, Roz. So next we're going to talk about Apple Health and then managed care plans and just an overview of both of those. So there's two kind of application pathways to Apple Health in Washington. The first is, and this is the path that most people apply through, it's Washington Health Plan Finder. It's the application where COFA Islanders applied for COFA Islander healthcare and COFA Islander dental care. It's a one-stop shop for Apple Health and qualified health plans. So when you apply for Apple Health through Washington Health Plan Finder, you're applying for programs that are referred to as MAGI-based medical programs. MAGI stands for Modified Adjusted Gross Income, and eligibility includes income limits, household size, and residency. Here is a chart for 2021 income for Apple Health, MAGI-based Apple Health. Looking at this chart, we can see Apple Health for adults as the top line. This is based on household size. So for a single person, the income limit is $1,482. However, just because you see this income limit and think that you might be over, I still want you to apply for Apple Health through Washington Health Plan Finder. You might have a tax deduction that will reduce that income, or maybe there's a tax dependent that you should include. If you may be over income for these programs, there are other options for health insurance. They include qualified health plans, and during this time, there are some really low cost qualified health plans that you may be able to purchase. So we talked about MAGI-based Apple Health through Washington Health Plan Finder. The second main path to apply for Apple Health is through DSHS and their website, Washington Connection. These programs through Washington Connection are referred to as non-MAGI Apple Health. They're for individuals who are age 65 and older, who have a blindness or disability, or are in need of long-term services and supports. While just like with MAGI-based non-MAGI, you can apply online or submit a paper application. Eligibility criteria for Apple Health programs through DSHS varies by program and is based on household size, income, and resources. Once you are enrolled in Apple Health, you will receive a ProviderOne services card. If you already had Apple Health in the past, you will not get a new one. Those cards remain good. They're kind of lifetime cards. That card is still valid. If you have for some reason lost it, you can request a replacement, but that card is still valid. You'll also enroll in a managed care plan through a managed care organization. Diana is going to talk a little bit more about that in just a minute. And you'll receive a letter with your Apple Health welcome booklet link to view online. If you don't like going online to review the booklet, that's not a problem. You can request a paper copy. A little bit more about the ProviderOne services card. So each person in your household that has Apple Health will receive their own services card. You can request a replacement online through the ProviderOne client portal. You can also view your number through the Washington Health Plan Finder mobile app, WaPlan Finder. This ProviderOne services number will be needed to receive services. This card, if you're looking through it, digging through your stack of cards, it's a blue card with the state of Washington on it, as you can see here. And Diane, I'll hand it over to you.
Okay, thank you, Ari. So I'm going to share about the managed care enrollment process. For non-MAGI individuals, you'll receive notice of enrollment into a health plan and instructions on how you can change that plan. You'll also receive information regarding the enrollment handbook and managed care. For earlier enrollment, newly eligible individuals are enrolled in managed care plans effective the first of the current month. Here's what you can expect. Once the COFA Islanders are enrolled in a managed care plan, their MCO, managed care organization, will contact them with some initial health questions. Responding to these questions allows the MCO to assist you with coordination of necessary healthcare services. Here's a map of the state. It is broken up by what we call regional service areas. And it shows which counties are in those, what we call RSAs. And within the map, it shows the different plans that are available to you in those regional service areas. And what is integrated managed care? Integrated managed care is also referred to as whole person care. The managed care organization coordinate and pay for both physical health and behavioral health services. Behavioral health services can include mental health and substance use disorder treatment services. For more information on behavioral health recovery, you can visit this link at the HCA website. How to work with the MCOs. Individuals may contact their MCO for help and questions with translation services, either written or verbal, coverage of their primary care provider, assistance in finding coverage specialists, and how to use the MCO website. They can also assist in other questions you may require. If you would like to change the plan that you were enrolled with, you may do that monthly. It is always prospective, meaning that it begins the beginning of the following month. And managed care plans can be changed in a number of ways. You can call our customer service toll-free line at 1-800-562-3022. You can go online to providerone.org/client. You can go to the Washington Plan Finder mobile app. Or again, you can go online to the WashingtonHealthPlanFinder.org. The changes are effective the following month, as I shared. All right, back to you, Ari.
Thanks, Diane. So this is an image of Washington Health Plan Finder. So we can see Bernard Samples is enrolled in Washington Apple Health. He can change his current plan by selecting the green button that says Shop for Current Plans. When he selects that button, he's going to come to a plan shopping page. We can see that Mr. Samples had been enrolled in Molina Healthcare of Washington, as indicated at the top. He can either choose to keep this plan or review the options that are available in his area below. So there's some tiles here, for example, AmeriGroup, Community Health Plan of Washington, Coordinated Care, and still Molina. So if he needed to change his plan for the next month, he would choose one of these options.
Thank you, Ari and Diane. Now let's take what we've learned and apply it. Here are some scenarios. So our first scenario, Julie had the COFA Islander healthcare until July 1st, when she transitioned to Apple Health. She goes to the pharmacy on July 16 to get her prescriptions. What information does she provide? Since Julie has Apple Health beginning in July, she will provide her managed care card and ProviderOne services card, or tell her pharmacist she has Apple Health. Scenario 2. Julie had COFA Islander healthcare until June 30. On July 10, she received a bill for her January hospital stay. Can she use her Apple Health to cover this bill? No, Julie had COFA Islander healthcare in January. Her COFA card or her Navia card is active until September 30. Once she confirms her insurance plan paid their part, Julie will use her COFA card to pay the balance. Scenario 3. George moved to Washington in July 2021 and wants healthcare coverage. He is 49, does not have Medicare, and is not working. His cousin told him about the COFA Islander healthcare, and on August 25th, he submits his Washington Health Plan Finder application. What is the outcome of this scenario? George is eligible for Apple Health. Since he applied in August, his coverage will begin August 1st. He can select a managed care plan or have one assigned for him. Scenario 4. Rebecca has COFA Islander healthcare and her children have Apple Health. She transitions to Apple Health on July 1st. Which managed care plan will she have when she enrolls in Apple Health? Rebecca will have the same managed care plan as her children. She will need to ask her doctors if they accept Apple Health and the plan her family has. I turn it over to you, Ari.
Ready, Roz? Okay. Next scenario. Rebecca's spouse, Steve, had employer-sponsored insurance and could not get COFA Islander healthcare. Can he get Apple Health? He might be eligible if he meets other requirements such as income and residency. Having other insurance does not disqualify an adult from receiving Apple Health. Next scenario is Sam is 72 and applies for Apple Health with DSHS. His income is from Social Security and it's $342 per month. He also has resources in a savings account of $2,800. He is not eligible for non-MAGI Apple Health because he has too many resources. How can Sam have healthcare coverage? He might be able to get COFA Islander healthcare if he applies through Washington Health Plan Finder. Next scenario, number 7. Mary is age 57 and has Medicare. She receives $897 per month in Social Security income. She needs help with her Medicare premiums and heard that there might be an Apple Health program that can help. Where does Mary apply for Apple Health? Mary applies with DSHS through WashingtonConnection.org. She is approved for the program Medicare Savings Program and has her Part A and Part B premiums, deductibles, and co-payments covered. Scenario 8. Julie is 27, single, and works at a casino. She earns $4,000 per month. She applies for Apple Health because she heard it was restored for COFA Islanders. What is the outcome of this scenario? Julie is not eligible for Apple Health because she is over the income limit. While Apple Health has been restored for COFA Islanders, they must meet all eligibility requirements. She may be able to purchase a qualified health plan on her own. One more, Roz. There we go. Okay, scenario 9. Jack was in the hospital in April and did not have insurance. Jack applied for Apple Health in July and was approved for Apple Health, which began July 1st. He selects a managed care plan and receives his cards. How can Jack cover his hospital stay? Jack can request retroactive medical coverage for the month of April. HCA, the healthcare authority, will review his request, and in this scenario, he's approved. Jack can call the hospital and provide his ProviderOne services card and let them know he has Apple Health for the month of April so that his stay can be covered. So retroactive medical coverage here is a possibility for the 3 months prior to the application month. So if somebody applies and is approved in July, or if somebody applies in July, the retroactive months are April, May, and June.
Thank you, Ari, for going through the scenarios with me. We will move on to resources. We have a dedicated page for the COFA Islander programs. You will find information on the transition. On the SNP, you will see that we have information on how to apply for Apple Health, as well as FAQs on Apple Health. These documents are translated in the 6 main COFA languages. In addition, we have resources on free or low-cost health coverage brochure. Welcome to Washington Apple Health Client Benefits booklet and COFA Islander programs information. Please visit our webpage for more information. And if you've not, please sign up for Gov Delivery to receive updates and new information on COFA Islander programs and Medicaid transition. To getting and keeping Washington healthy, the pandemic is still present and Pacific Islanders have one of the highest rates and impacted largely with COVID-19. HCA has a dedicated webpage on COVID-19 resources. And we'd like for you all to stay connected. Please follow us on social media. And now we'll open it up for question and answer. Before we move on with our question and answer portion, I'd like to welcome Driscoll. Driscoll, if you'd like to introduce yourself and give a little information on the work that you do out in the community. You may want to unmute.
Thank you. Excellent presentation, team. I'm one of the resource navigator in the community for COFA, and I'm here ready to go along with the team here with any help that you might need, especially for Cochran community with the interpretation and to help understand what all these things mean to us with all this presentation. So I'm here for you to stay connected with you. So please apply for the Apple Health. As you can see that there's more benefits to it than what we had before with the COFA insurance or the dental care. Thank you very much, Steve. Thank you.
Thanks, Driscoll. So we'll open it up for question and answers, and we'll start with our community members on the panel. Do you have any questions that community members may have asked you or approached you with? Do you have any questions on the Medicaid transition? We'll start off with you all.
If I can start with a question to break the silence here. I don't like dead hair. So I wanna, the question I have is, so let's say that I become eligible for disabled health. So can you give me one or two benefits specifically that it has over the COFA health insurance that I have had in the past year?
That's a great question, Driscoll. So the first thing is medical, vision, and dental are all under the Apple Health umbrella. So when you had COFA Islander healthcare, you had to go through the plans and see some had a vision benefit, some didn't. Apple Health, when you get Apple Health, you have a vision benefit. Same thing for dental. We had the two separate programs, COFA Islander healthcare and COFA Islander dental care. It's all rolled up into one. For the vision and dental benefit, you're just going to use the ProviderOne services card. You don't use the managed care plan, but everything is just rolled up into one. You don't have to go searching for a different plan or make sure that you pick the right one for the vision because it's included. Another big one, a difference here is transportation. There is a non-emergency transportation benefit for individuals that have Apple Health, to help you get to your appointments.
Thank you, Ariel. And if I can follow it up with another question, and then I'll give respect to my other colleagues here to ask question also. This may for Diana. I know from the COFA health insurance, we had what is called a silver health plan. So I know some families have MBATR in the same household, and some have United Healthcare or Molina. And so how is it the plan with this Apple Health different than what we had with COFA insurance? With the managed care versus the the silver plan that we had. I think that's
really good question, Driscoll.
Okay.
So the COFA Islanders who will be transitioning will join the same managed care plan that their family has. I believe around 95% will connect with their family, and it may not be with the same company that handles their qualified health plan. I did do a survey with the MCOs requesting that exact information of what's different between the plan they already have and the one that they'll be enrolled in. And basically they indicated there was not a lot of difference. I'm not super familiar with the qualified health plans, But with the managed care plans, they do have a requirement to help coordinate care. So if an individual cannot find a primary care physician to see them, that is the responsibility of the MCOs to help them find one, as well if they're referred to a specialist. The MCOs need to help them find one. If they are not part of the managed care, what we call provider network, there may be an opportunity to do a single agreement with that provider, as long as the provider is willing, in order for that client to get the care that they need at the closest possible location.
Excellent, thank you.
I have a question regarding somebody that is younger than 65 that need long-term care, especially with, someone, when they needed help at home. Do they qualify for the Apple Health?
Possibly.
Uh,
So yeah, the long-term care, it's not just for people that are age 65 and older. If you need the extra services, they are, that's the path to take. The first thing I would do is apply. If somebody is under age 65 and does not have Medicare, the first thing is to apply through Washington Health Plan Finder. That's the first step, because that person might be able to get Apple Health through Washington Health Plan Finder. And then if they need the extra services, there is an option there. But the under 65 without Medicare, apply through Washington Health Plan Finder first. And then if they do need those extra services, there's actually a whole page of questions in Washington Health Plan Finder that people can answer yes or no. So for example, do you need an in-home caregiver? Are you in a nursing facility? Can you no longer work because you have a health condition that prohibits it? So there's in Health Plan Finder, there's a whole page of those questions where you can go and say, yes, oh, this is me. Say yes to those questions, and then there's this whole process to look at those services for you.
Are we, oh,
Yeah, go ahead,
are-
Roz.
yeah, I see that we have some questions in the comments. So with the transition in place, are there any extra steps we need to take?
So if you are brand new and you don't currently have COFA Islander healthcare, the first step is to apply. Submit your application, see if you're eligible, or if you had an application or you had COFA Islander healthcare 3 months ago or last year, but you don't have it right now, update your application. That's the first step. Now, if you have COFA Islander healthcare and you are in the group that is going to transition to Apple Health for adults July 1st, one of the things you can do is, if you go to a clinic or a doctor, ask them, I am moving to Apple Health. Do you take Apple Health? And then if the answer is yes, the next question is, which managed care plans do you take? Because as we talked about, you can change your plan if for some reason you're enrolled or your family is enrolled in, I'm going to just throw on examples here. Your family's enrolled in coordinated care, but the doctor that you go see and you have to see for your condition only takes Molina. That's information that you want to know, and you can get that information now. And then again, you can change it for the future. And Diane, can you talk a little bit about the coordination between the months a little bit?
Sure. There can be an access concern that you are enrolled in a managed care plan that will not allow you to see the PCP that you want to see and have been seeing. And what are your options? The options are to request that managed care plan, coordinate perhaps for a single what we call a single case agreement, but a single contract with that provider. However, the provider has to be willing to work with that managed care plan, and not all providers are willing to work with all of our plans. So the other option would be to call our customer service toll-free line and share the concern that you have and request a medical exception. And that, if approved, will allow us to backdate your managed care enrollment, basically switch plans for you same month. It does require a little bit of work on the healthcare authority side, because we have already dispersed payment to the first managed care plan you were enrolled with. So we do have to do a lot of communication and work on what we call recouping payments and repayments. But it is possible, but it is definitely an exception due to the process it takes to get there. So really the number one option is to request that the managed care plan reach out to your PCP and see if they can coordinate enrollment with that managed care plan, whether it's permanently or on a single case situation.
Thank you, Diane.
We have another question. I believe this is on services. How do you access the transportation service?
So we do have a great website, hc.wa.gov, and there is a whole page on benefits, and on there is transportation. So when you have Apple Health, there are a couple of things that you have to do first, and that is one, make sure that you have a current ProviderOne services card. So again, that you are active and receiving Apple Health. The second is that you have no other way to reach your healthcare appointment. The third is that when you're going to your appointment, you want to make sure that that appointment is covered by your Apple Health program. There's a whole page dedicated to transportation. It includes contacting a transportation broker to help you get there. It's based on counties. They're different brokers based on your county, which is all, again, listed on the non-emergency transportation services page of hca.wa.gov.
I have another question regarding an household with multi-families. How do they apply? Can they just be included in one application, or do the family have to fill up different application for each family? And just know that in our families, we have maybe more than 6 members, or maybe 6 or less, or more. And 3 families live in one household using the same address.
Yeah,
How do they apply for the insurance?
that's a really great question, Dorothy. So when we say households, it really comes down to tax household. And so it doesn't mean that everybody, not necessarily, sometimes it does, but not everybody living under the same roof. That doesn't mean the same household. It's who is going to file taxes together. If you have 3 separate families under one roof and 3 separate families are going to file their own taxes, then they would have 3 separate applications. It really comes down to who files taxes and who is going to be claimed as a tax dependent. And I know for Apple Health, that's one big difference between Apple Health and COFA Islander Healthcare. So even though we say tax household, it does get a little bit trickier because you don't actually have to file taxes to be eligible for Apple Health, but it's kind of the easiest way to think about it. So if maybe you have 3 different families that won't be filing taxes, but if they did, they'd be on, they'd be 3 separate tax filing applications. I'm saying that incorrectly. Oh my gosh. But that's another way to think about it. So you don't have to think about it. If you're not sure, the application, Washington Health Plan Finder application, will tell you. It will count people or not count people. So if you add your cousin who is in your house, but you're not going to claim them on your taxes, it won't end up counting them in your application, and you won't actually be able to get Apple Health for them either. I said a lot of words there. What kind of other follow-up questions? Are there any other household questions there?
I also have another question regarding, someone on alien emergency medical assistance. Can they also cover under Apple Health? Or
Yes.
how is that going?
Yeah, so the benefits they were receiving, so Alien Emergency Medical, or AEM, is a program for people who can't get Apple Health because of their immigration status. So that's something that many COFA Islanders had. It covers 6 main emergencies: ER visits, inpatient hospital stays, outpatient surgeries, and then the 3 big ones: cancer treatment, dialysis, and anti-rejection medications from an organ transplant. So those things, once you have Apple Health, those are covered services. Now, it might, I'm not sure, again, it comes down to managed care plans. If you're going to one place for your dialysis, again, you want to make sure you're going to tell them that I'm getting Apple Health. Which managed care plans do you accept?
Thanks, Ari. We have another question. My mom was approved before, but my mom was approved in the past, but when she tried to apply this year, she was denied. She still has the same info that she had used when she applied. Do you have any suggestions or any resources we should take?
I'm not sure, there are many reasons why somebody may be denied Apple Health or COFA Islander healthcare. I'm not sure if that person is referencing COFA Islander programs. There is the requirement that you file taxes to retain your tax credits for COFA Islander healthcare. And even if you do file your taxes, but don't file them with that special form, the 8962, you might be denied tax credits in the future. I'm just trying to think of some other reasons. That might be one of them. If you ever have questions about your COFA Islander healthcare or COFA Islander dental care, we are maintaining our email and phone number. So our phone number, and Roz and I we're there to answer your calls. It's 800-547-3109. And then you can email us as well, COFA questions with an S on the end at hca.wa.gov. Driscoll, do you have a question?
Yes, I do. And those things, the website that you just mentioned will be made available for people because they can remember all that cuff stuff that we're talking about. Resources will be available. My question is the emergency, just like I see one of the question was asking, where can we apply? Let's say one of a family member goes to the hospital and they didn't have any of this. Is the hospital equipped with registering a COFA Islander at the scene or at the hospital with one of the social worker at the hospital? Is that going to be available or is it already available? a provider at the hospital, like a social worker, because I know they always ask this question: do you have insurance? And if you're not, there is a charitable form here that you can fill out. Beside that, is it possible that they can get Apple Health at the spot at the hospital? I know we're campaigning to have everybody fill out the application now, but let's say if it comes to that, how do we approach that?
Yeah, I think that a lot of hospitals and facilities do have people that can help apply for insurance through Washington Health Plan Finder. They can give resources. I don't really want to speak for the hospitals because it's not, I don't work for them, but from my experience working with the community and providers, a lot of the hospitals, there are staff dedicated to helping people apply for insurance. One of the things to note though, is that if the answer to that insurance question is no, and they leave the hospital, there is the possibility of retroactive medical coverage. So you apply in 1 month and you have a medical bill from the 3 months prior. We can look at approving Washington Apple Health coverage for the month that you received that bill.
Okay, thank you, Ariel. And I just want to follow up with this. You may have answered it already, but I just want to be on the same page with you all. We have helped a lot of people sign up for the COFA insurance and the dental care, which I'm so encouraged that everybody will be, transitioning to getting the Apple Health. My concern is that, let's say if somebody for any reason because of the COVID, how can a bill that was supposed to be have paid by the COFA health insurance can be taken care of now that we have this transition? Let's say there's some leftover bills because communication is really bad during the COVID. There's a lot of things happening. It's the last thing I want to deal with. So now that we have a transition, who's going to take care of that bill, or is there a way to accommodate that?
There most certainly is. Rose, do you want to answer, or would you like me to?
Hi, Jisco. Thank you for that. Thank you for that question. So when the COFA Islander healthcare ends, the COFA card or the Navia card will remain active. So if there are bills that was received after the transition and they were in the COFA Islander programs, they can use their COFA card to pay their bills if it's a co-payment or if it's in-service billing. Ari, did you want to add on to that?
Yeah, so we are keeping the cards active for 3 months after your COFA Islander healthcare and COFA Islander dental care ends. We know that sometimes bills come, they come a year later, right? So that might be after the card has been ended. Again, contact us, email, phone number, reach out to us so that we can work with you to make sure that bill is paid. We don't want you going to collections.
Thanks for that, Jisco. I think a lot of our COFA clients had that question. We've been getting those as well in the past couple weeks. We have another question in the comments, and it is, will vision be covered by Apple Health for 18 and older?
The answer is yes, but it's the benefits are different for children versus adults, but there is a vision benefit. And that's across the board. So again, when you have COFA Islander healthcare, you had to pick the plan that had the vision benefit. Apple Health, you get a vision benefit. It just is across the board. And again, it's different for children versus adults, but it is a benefit available to you.
And I think that that's a question that we've been asked, especially for those who have health plans that include vision. And I think we can repeat that you cannot have both the COFA Islander Health and Apple Health. Once you transition to Apple Health, your COFA Islander ends.
And this is Diane. I would like to add that the vision benefit changes as of the client's 21st birthday. We do not have an 18 or younger benefit.
Is that, Diane, am I remembering, is that the same for dental as well? No, okay.
No, dental coverage was reinstated about 5 years ago for adults. So covered, there are different services available to individuals under the age of 21 than adults. But in general, they have a benefit lifetime.
Thank you, Diane. We have another question. If I'm not working, can I still be eligible for the Apple Health?
Yes. When you, so there's an income limit, there's no income minimum. So some people have negative income, and you can still be eligible for Apple Health.
Ariel, what about these, like for, if I'm insured by my employer, can I still apply for Apple Health?
Yes. Having insurance through your employer does not disqualify you from Apple Health. It does disqualify you in most cases from COFA Islander healthcare. So that's another good difference to point out, Doristy, is that so the way that it works is if you are eligible for Apple Health and you have other insurance, Apple Health becomes secondary coverage. So your employer-sponsored insurance is your primary insurance, and then you give them your Apple Health information.
And so this is a follow-up question regarding my other question. Is so if, I have my employer's, my insurance from my employer, but then I want to use Apple Health most of the time. Is that something that I can do?
So again, it's not, if you have insurance through your job and you have Apple Health, when you go to the doctor or pharmacy, you're gonna give them all of that information. And the provider, pharmacy, they'll know how to do it, but what it means when Apple Health is secondary is they'll bill your insurance through your job first. And then if there's anything left over, then they go through Apple Health and bill through Apple Health or your managed care plan. So again, today we're talking about the transition from COFA Islander Healthcare to Washington Apple Health Medicaid. It was restored, Apple Health Medicaid was restored for COFA Islanders. And again, COFA Islanders are Pacific Islanders from 3 specific nations: the Republic of Palau, the Republic of the Marshall Islands, and the Federated States of Micronesia. Medicaid was restored at the federal level through a Consolidated Appropriations Act back in December. We've been working through system changes and rule changes to make sure that when COFA Islanders apply for coverage, they'll get the right determination. So instead of being denied Apple Health because of your immigration status, that will no longer be the case after the end of this week, because system changes are going into place. And you will now, once you apply after those system changes, you still have to meet income requirements. So you still have to be under income. Again, there's an income limit, there's no income minimum. So, and other things like that. So one thing to note is sometimes I hear, I don't work, but my husband works. Well, you're married and you're in the same household, his income counts for you. So even if you're not working, it's the family's income. So that's one thing you have to look at, but you don't have to think too hard about it, because when you go into Washington Health Plan Finder, it asks all the questions that you need. You just need to think about who's in your household, how are they related to you, and then it will ask, does this person have income? What type of income? Things like that. In Washington Health Plan Finder, there are also income calculators. So if you don't know how much you make per month before taxes, but you know how much you make per hour and how many hours a week you work, there's a calculator for that. You don't have to pull out your phone and start doing some math to figure it out. So once the system changes go into place, COFA Islander Healthcare will be the option for people that are over resources for Apple Health through DSHS. Trying to look at the questions here. We've just got 3 more minutes. This hour has flown by. Thank you so much for everybody who's joined us.
One last question for me.
Yes, yes.
Is there any medical condition that Apple Care or this insurance cannot cover?
Cannot cover?
Yeah, with payment,
I don't
like
know.
cancer or anything. It can cover everything. Okay, thank you.
Mhm. Just looking through the questions here.
I believe we have a question about sharing the map of what plans for each county. We've shared that on the comments, but you could also find it on the HCA website, and we will share it. You can find it at hca.wa.gov/service area maps.
Yeah, and we included this on that link on the resource tab of our presentation. So this is being recorded and will be posted on Facebook Live. So once it's over, you can go back and look through this. If you have any questions about the transition, you're concerned about coverage change or anything like that, our phone number is 1-800-547-3109, or you can email us at cofaquestions@hca.wa.gov. You can also visit our dedicated webpage. We've created and translated materials on this transition, and that is hca.wa.gov/COFA. Roz, in the last minute, you want to take us out?
Yes, thank you. Again, we want to thank our community members, Doris D. Daniel and Driscoll Jack, for joining us. Thank you, Diane Baum, for joining us as well. Please continue to wear a mask. Be safe. Thank you, and we hope you all have a good evening.